Well, being in the public and helping people in our drugstore, I thought it was very important to protect not only myself, but my staff and the people that come into my store. Also, being a vaccinator myself, I wanted to be an example for those that are getting the vaccine, that it's extremely important to keep this community safe and healthy. So I did it for myself, but I also did it for those around me.
I decided to get the vaccine because I wanted to protect others around me and myself and be able to have the chance to get back to life as we know it.
Yeah, I chose to get mine because I'm around people all the time here at the soup kitchen, at the school system, coaching, mentoring. So I thought it'd be safer to just go ahead and get it done versus not having it done and have a greater chance of catching COVID.
I chose to get it because my whole family, my wife and I and my 2 children, 2 boys, received it in October. We got the COVID. All 4 of us was sick. I was probably the sickest out of them all. And I'm the one who's got diabetes, high blood pressure, cholesterol. And let me tell you something. It knocked me down for about a week. And now for my wife and my youngest son, wasn't that big of a deal. But my oldest son, he was sick for a day or 2, but it really knocked me out. So I was excited when this vaccine was coming because I did not want to get sick again. The second reason why I did this was for my YMCA family. And, you know, we average about 15,000 people come into this YMCA per month. And I don't want to spread it to them. You know, I think it's something that has helped me. The shots were nothing. None out of the 4 of us, none of us got sick. And also, you know, I have a son that's a PA in the medical field. And he suggested, his friends suggested, and every doctor that I see that comes through this YMCA, they suggest, hey, the vaccine's out there, get it. It will save lives and it will keep people from getting sick.
Well, I'd say that we want to get life back to normal, and being vaccinated is a huge, huge part to that. You know, the vaccine is, you know, there's so many people that have gotten it. We're seeing COVID numbers go down because of that. And let's get our community back to where it was. Let's be able to go out to eat. Let's be able to do all the things that we're used to doing and enjoy each other in summer. So it's important to do this because we want to get back to life as normal.
I would tell them that the risk of getting COVID and becoming extremely ill or even worse is much greater than any possible side effects from getting the vaccine itself.
I'll say go ahead and do it. I mean, I got mine about 2 or 3 months ago and I'm fine, no ill effects. So I've still got all my limbs, nothing extra growing. So I say go ahead and get it, especially around people a lot. And if you're very, very, you know, scared that you're gonna get it, go ahead and get it. It's not gonna hurt anything. I said, you got the flu shot, you get these other shots, you already put stuff in your system that, you know, can harm you anyway, even food. So why not get the shot?
I would say, you know, go ahead and do it. And you know, I know it sounds sort of simple, but, you know, it's something that was a good thing from us. And I'm gonna be honest with you, I feel very, very confident walking around this YMCA. I feel very confident walking into restaurants or going into grocery stores or Lowe's or anything like that. And let me tell you something, I'm ready to get rid of this mask. That's probably the biggest thing that I want to do is to move on and get back to normalcy. You know, we talk about that as a family. We talk about that as a staff here. You know, we're ready to get back to normal.